Hello everyone, I am Dr. Tejashri, Senior Consultant Obstetrics, Gynecology and Infertility Specialist practicing in various hospitals in South Delhi and majorly in my own clinic, Medfemme Women's Clinic in Hauz, Khas. So today we are going to discuss a very interesting topic, and I would like to tell you about 6 things that you should know when you are planning a pregnancy. What are those 6 important things? Let us discuss. So, these 6 important questions that I would answer today will help you in preconception health. Why is it important to achieve a preconception good health? Pre is before, conception is the process of getting pregnant, and health means that you are mentally, physically, and socially healthy to undergo a pregnancy. It is a healthy couple would lead to a safe pregnancy and a healthy baby. So it is very important that both the partners are healthy when they are starting to plan a pregnancy. The first and foremost thing is start taking folic acid. About 400 micrograms of folic acid is what is suggested by the Indian Medical Association and FOXY and various international forums, that this is the amount of folic acid that you should be taking if you are planning a pregnancy. It is very important because it prevents certain major malformations in the developing fetus, majorly the neural tube defects. So you should start taking folic acid supplements as soon as you are planning a pregnancy. The second important thing when you are planning a pregnancy is to stop drinking, smoking, and cut down on your caffeine intake. There is no specific level of alcohol, above which there would be a problem to the baby or the mother. So it is suggested and guidelines have told that you should stop drinking alcohol as soon as you are planning to get pregnant. There are no safe levels during pregnancy. So if you discover that you are pregnant and you are still drinking, that could be harmful to the developing fetus. Same with smoking. As soon as you are planning to go ahead and have a pregnancy, you should completely quit smoking, because smoking is something that's really harmful to the developing organs of the baby, and you should immediately quit smoking. In fact, both of you and your husband should quit smoking whenever you are going ahead and planning a pregnancy. The third important thing is that you should limit your caffeine intake. Now, how much amount of caffeine is safe during pregnancy or even before that? So, according to our guidelines, about 200 milligrams of caffeine in a day is safe to have or safe to consume even if you're pregnant. So, why not to come down to that level right when you're planning the pregnancy? But how do you know that you have consumed 200 milligrams, or how do you know that you have reached your limits? So there is an easy thing to remember, that how much is safe. And I would put up a chart right here for you to understand that how much is safe and what all can you have during your pregnancy and in what amounts. The third important thing is check on any medications which might be unsafe for the developing fetus, and if you're taking them regularly for some of your problems, specifically epilepsy and the drugs required for epilepsy, drugs required for the depression problem might be, they might be toxic to the developing fetus and need change, or they need to be stopped before you get pregnant. So if you are on certain medications that you need to take daily for the problem of epilepsy or depression or certain psychiatric disorders, please see your medical practitioner and tell them that you are planning a pregnancy, so that they give you some alternate medications for the same, or they might decrease the dose to a certain level which is not harmful to the baby. The third important thing to be discussed with the doctor, pre-existing medical conditions like diabetes, hypertension, asthma, or any other medical disorder for which you are regularly taking any medicines, please discuss it with your doctor so that they can optimize the dose of the medicine, optimize your health. It's very important that your sugar is under control, your blood pressure levels are well controlled with medications and diet and everything. and that you are in the best of your health, the medical problem is well under control before you go ahead and have a pregnancy. So it's very important that you address your medical conditions. The second important thing in this point is that you should also discuss about any complications that you had during your first pregnancy, in case you had it, so that we can do certain preventive measures. We can give you certain medications so that those complications are not repeated in the second pregnancy.